Fort Bragg is actively taking measures to ensure that our soldiers, their families, and our local community is protected as much as possible from Ebola, while we continue to execute our worldwide mission of deploying forces, especially those deploying in support of Operation United Assistance. The garrison commander gave us all guidance that he wanted to work on a coordinated operation where we ensure that we're supporting each other's assets and our missions, and that assets are in place and that everyone is trained and that they know what everyone is doing, so that when it comes time, heaven forbid, that we have to go into our measures, that we are able to work effectively and quickly. He's also, all of our efforts are being coordinated, not just here on Fort Bragg, but also we want to stress that this is all being done in conjunction with North Carolina assets and local communities. We're also receiving assistance from other federal agencies. We're confident that our procedures are going to be effective, but please understand that that doesn't mean that we are 100% protected from any sort of an outbreak. No one has that crystal ball to see what the future brings. But what we can tell you is our assets will be in place, our personnel will be trained, and everything will be prepared to execute if we have to go into that. We've identified our procedures for this, and that everything will continuously be updated as the situation changes and develop. As for units deploying, Fort Bragg will be deploying 120 soldiers in support of Operation United Assistance, members out of the 16th MPs, the 10th Press Camp Headquarters, the 20th Engineers, the 44th Medical Brigade are all deploying throughout the region of AFRICOM's operation, which again is Operation United Assistance. They will not be working directly with infected personnel from the host nations where we're going to be operating in. Their whole effort is to ensure that the U.S. effort is fully being executed to the best of its capability. Now also, before the soldiers come home, they will be medically cleared before they are reunited with their families. Colonel Stevens.
Good afternoon. I'm Colonel Ron Stevens, the commander of Womack Army Medical Center. Thank you for this opportunity. Bottom line up front is that the Fort Bragg and Fayetteville communities should understand that our team is prepared to respond if a patient who is potentially infected with Ebola comes to any of our facilities. For the last several weeks, Womack Army Medical Center has been developing, implementing, and improving processes and procedures to identify and isolate a potential case of Ebola as early as possible in a patient encounter. Our team has collaborated with health officials from local, state, and federal agencies, as well as leaders in the private sector. We are committed to protecting the safety of our staff and community while providing world-class evaluation and care to anyone infected or possibly infected with Ebola or any other communicable disease. In addition to numerous discussions and teaching sessions, our staff has participated in rehearsals to refine procedures and improve our processes. We will continue to work to improve our processes while praying we never have to employ them. Thank you very much.
Okay, ready for your questions?
Colonel, if you could be a little more specific when you say your procedures and plans are in place. Give us a quick thumbnail of what those procedures and plans are.
As soon as a patient is identified as potentially being infected, they will be isolated and taken to a site separate from the hospital where they will receive an appropriate and thorough evaluation and appropriate care while we're finalizing the evaluation to determine the appropriate clinical course for them.
Sir, I've got a question for you. You mentioned that before the soldiers are reunited with their families, they will be, well, do you know the answer to this question, sir?
Well, Mr. McCallum.
Keep going.
Well, who does that mean that once they're getting ready to redeploy? Tell me what that means.
It basically means that they will be screened to ensure that they have no symptoms in place. And again, the symptoms will start to identify themselves within the first 10 days. And so that when they come home, that they will be cleared to be reunited with their family. The details of which we can't really get into because a lot of this stuff is going to be executed over in theater.
Well, that's the point. Are they going to be brought back to Fort Bragg and kept away from their families for 21 days? Or are they going to be in country, in a place where you know that they're not going to be? That's what I want to know.
Right. That part has got to get locked in with AFRICOM. so that we have it fully in place. It will be in place before the soldiers ever deploy. Remember, they haven't deployed yet.
What's our timeline for those guys being deployed?
We're standing by,
Waiting on orders or just more training?
waiting on orders.
Can you talk about, when you say you're ready to treat, are we talking about soldiers, or are you going to be working with the civilian community in case, God forbid, family members, people in the community may have come in contact with a potentially infected or a soldier?
There are 4 civilian institutions that have been identified for the care of Ebola or potentially Ebola victims, and so any civilians would be cared for or would be provided care at those sites. We're prepared right now to respond to any soldiers who may be infected.
How confident are you that you can keep the Ebola from spreading potentially outside of Womack?
I'm very confident
Why?
because we have developed processes and procedures that have been rehearsed that will ensure the safety of our staff, that will isolate the patient as quickly as possible and ensure the safety of our staff so that they don't become potentially infected and a risk to spread the virus outside of the facility.
Are y'all triaging, or will the actual patient stay here once they come here? Or will you stabilize them, triage them, and then send them to some other facility?
Right now, the plan would be for us to evaluate, stabilize, and get them transferred to another facility as soon as possible.
What would that be, like Walter Reed or?
No, right now, the only places that have been identified to treat patients are civilian institutions.
Can you talk about how many of the negative pressure isolation rooms you guys have got?
We have 4.
Sir, I talked to the Director of Infectious Disease at Cape Fear Valley Medical Center earlier this week. He had mentioned that he was coming to Fort Bragg today. Talk about the coordination with the local hospital with Cape Fear Valley Medical Center.
I have not been involved in any coordination with Cape Fear to date. All of our coordination in terms of actually taking care of patient care proper has been with our higher authority with Northern Region and MedCom.
So you guys are saying, both of you are saying that no Fort Bragg soldier is going to be directly in contact with a potential Ebola.
That's correct. That is correct. Right now, all of our missions are geared towards supporting other U.S. assets that are there, supporting the outbreak measures by U.S. aid. Also, I want to expand some on what you had asked the Colonel. Remember, a lot of these procedures that are going to be implemented take place before the patient ever shows up at Womack, all the way from when the telephone call comes in saying, I believe I have it, to the way we are going to transport that person, to include all the way to the very end of how are we disposing of personal property.
So to touch back on the point you just started there with the job duties, could you just give us a few examples of some job duties?
Well, they're all going to be working within their specific trained MOS. The engineers, exactly what they're going to be doing, no, I cannot get into that full, other than the engineers working to ensure the ability to have the facilities in which to work with to execute the mission is in place, logistic personnel to keep the flow of supplies coming in and out, and medical personnel to ensure that our people do not become infected while in theater. One thing I want to stress in that is, remember, it's not just Ebola that's over there. There are other diseases that they've got to protect all of our soldiers from.
Have you heard of any plans in stand-up for additional troops, 120, or is that going to be about it?
Right now, we've got to wait for those decisions to come out of DOD and DA. We'll follow and execute the orders that will be directed towards us. And we don't want to speculate because.
But 120 people does not sound like a whole lot of people.
Remember, this is only Fort Bragg.
Yeah.
And it's, as the president put out, 3,000.
Yeah. So that's what I'm saying. This is like headquarters and support mostly that's coming out of Bragg.
Yeah, a wide variety of abilities going.
And so the medical brigade folks will not be coming in contact with disposing of any potentially contaminated material or clothing?
As we understand it, that is correct. They are all geared to support U.S. personnel in theater. Folks, other questions?
The only thing I had is, if a family member is potentially exposed, do y'all treat them, or does that fall underneath the civilian facility?
We will provide care for family members as well.
And you explained to Gilbert, it is gonna be a 21-day isolation period?
Well, again, that's a process that's still being worked right now, and part of that, you know, the redeployment process, it's not like a flight from an overseas location back to the United States when when soldiers redeploy. There's a more iterative process that occurs, so there'll be several days from the time that they find out that they're going to redeploy until they actually hit the ground here. And so exactly what the process will be, you know, we really can't comment on right now because that's going to be developed and determined based on the redeployment cycle.
No idea yet of when the guys will leave?
No, not yet, and obviously no idea when they're going to be returning. This is all mission dependent and upon a directive from the Department of Defense. Remember also on all of our procedures that we've got in place right now and that we plan on executing, if things change due to the threat of an outbreak and what our soldiers are doing, obviously we're going to make adjustments, and especially in conjunction with North Carolina officials and other local officials and federal. As the situation changes, we work with them to ensure that our capability is matching theirs and that we're all mutually supportive. Guys, anything else? Anybody? Thank you very much.